Can I get a dental block for lip fillers? I get asked this question all the time because patients like big lips, they like voluptuous lips. Most of them want their lips to look natural, but they want to go through the procedure and know that they're not going to have too much pain. And their general impression is if you're going to stick something into my lip, that's going to hurt me, isn't it? So they want to know that they're not going to have pain during this procedure. So here's what I would tell you. It's sort of an interesting historical thing. We started injections in the lips with collagen. Nobody uses collagen anymore, but the interesting thing was collagen came in a very short needle and all of it was mixed with lidocaine, xylocaine, same thing. And patients did pretty well with these because the short little tiny needle and the lidocaine made it okay for them. And then a revolution came out, hyaluronic acid fillers came out. Restalyne, Juvederm, and many others that are hitting the market in the US today. In fact, in Europe, there are 190 hyaluronic acid fillers, a lot of them, more than we have. So when they first came out, they were not mixed with lidocaine. And because of that, the topical anesthesia that was used was sometimes inadequate. And so many patients asked for dental blocks. And what we would do in almost all of our patients is use some topical anesthetic, some topical lidocaine, and then we would inject underneath the gum and inside the lip, in the lower lip, to block them all around. And the patients had no pain from the procedure, but they left and had an hour and a half of numbness. They couldn't talk well, they couldn't eat, they were dropping stuff out of their mouth. It was not exactly good. And now, almost all the companies in the United States have mixed their hyaluronic acid with lidocaine, and it's a much better way to do things. They don't get a full dental block, and what we do is we put topical anesthetic on, we let it sit for a little bit, and then we inject a little bit of filler into the lip, and then we inject through the anesthetized area. So if the practitioner is good, they put a little bit in, they put a little more in, and the procedure gets less and less uncomfortable as we go on. If you go to a practitioner that understands this, you should be able to get your lips done with very minimal discomfort. And then the nice thing, if you use this in this way, you will not have any after pain because you'll have a little bit of local anesthesia around here. It won't last so long to give you an hour and a half that you can't eat, but it will do its diligence to keep you anesthetized and without pain during the procedure and for a little bit afterwards until you get the ice on and maybe get a Tylenol. So this is a really important thing. Now, occasionally, I still get the patient that comes to me and says, I'm really anxious, can you do a dental block? And for me, they're very easy. And most practitioners should know how to do this, and if not, they ought to learn how to do it. It's a pretty easy thing to anesthetize the infraorbital nerve and the mental nerve and make the entire area numb. If you have questions of how to have painless procedures, I'd love to help you. You can call or email myself or my office today. I look forward to speaking with you. I look forward to seeing you in my office so that you can get your lips done in a non-painful way. Thanks again for watching.